Friends, in this video we are going to watch a no Hydro Phaco. This is a cataract with grade 3 nuclear sclerosis. Let us watch the full surgery. This is the main incision with a 2.8 mm steel keratome at mid-limbus. Now a side port is made on the left side of the main incision. The side port is about 3 clock hours away from the main incision. And now an air bubble is injected into the anterior chamber, and underneath this air bubble trypan blue dye is applied to stain the anterior capsule. And now this is a bit of adrenaline. Now the dye is washed out using a Simcoe cannula. This is a 23 gauge Simcoe. Now the anterior chamber is filled up with 2% hydroxypropyl methyl cellulose. Here it goes. Then the methyl cellulose is applied over the corneal epithelium for better visibility. And now capsulorhexis. Capsulorhexis is done with this Utrata forceps. This is a totally unedited recording, and you can see how quickly we can do a rhexis. And now we are going to manage this nucleus without any hydrodissection. Let us see if there is any jonular stress or any other issue if we don't do hydrodissection. The phaco needle goes in, some superficial cortical lens matter is removed, and now the handpiece is turned to make the bevel of the phaco needle up towards the corneal endothelium. Now the tip is buried into the substance of the nucleus just in front of the main incision. It goes towards the opposite equator, and the chopper is used to get a very nice crack. Now the handpiece is turned towards 3 o'clock, and this is another chop, and we get a free nuclear fragment. This nuclear fragment is emulsified. And now the handpiece is turned towards 8 o'clock, and using high vacuum the nucleus is held, and we get another job and get another free nuclear fragment, and this nuclear fragment is emulsified. And by this time hydrodissection has occurred, and we can see that the nucleus is rotating. So as we get 2 free nuclear fragments, the fluid, the BSS, travels all around, and hydrodissection occurs by itself. This is the last nuclear piece, and it is emulsified in lower parameters. So far the vacuum was 450 and flow rate 45 ml per minute. During emulsification of the last nucleus and epinucleus, the vacuum is 250 and flow rate 25, and it is done keeping the tip at the center of the anterior chamber. So we have managed the nucleus and epinucleus without hydrodissection. This is easily possible in grade 3 to grade 4 nuclear sclerosis. We can even do it for grade 2+ nuclear sclerosis. it may be difficult for softer cataracts where we cannot hold the nucleus and we cannot get a nice crack. In those cases, in soft cataracts, we can try pre-chop. We will see if we can do that in subsequent videos. Now let us discuss why we should try this technique, no Hydro Phaco. Why should we try this? Because in some phacoemulsification cases, we will face problems. We fail to do a nice hydrodissection, the nucleus doesn't tend to rotate, and we become very much afraid to do the surgery. If we learn this technique, we can easily and with lot of confidence we can manage those cases. We can just try to chop the nucleus and get two nuclear fragments, and as we remove those two nuclear fragments, more hydrodissection occurs and the rest of the nucleus will rotate freely. If it doesn't rotate, we can do hydrodissection again. So rather than waiting for hydrodissection and try to rotate the nucleus again and again, we can employ this technique of no Hydro Phaco in those cases where hydrodissection is not proper and we fail to rotate the nucleus easily. Friends, I learned this technique from Dr. Narayan Bardului, founder of Chandraprabha Eye Hospital at Jorhat, Assam. He does all of his cases, even soft cataracts, without hydrodissection. If we learn this technique, it becomes another tool in our basket and we become more confident in doing surgeries, particularly in those cases where the nucleus doesn't tend to rotate after hydrodissection. Thank you very much for your attention. Hope this video will help you in developing your surgical skills. Be a great surgeon and serve your patients with love, respect, empathy, and great surgical competence.